ignorance and light over darkness. I request our Principal and Vice Principal to kindly escort our dignitaries for the lighting of the
Respected Chief Guest for the day, Professor Dr. Paul C. Salins, Medical Director, Senior Vice President, Narayana Healthcare, Majumdar Shah, Multi-Speciality Medical and Cancer Center, Bangalore, SRIDHAR Shetty, Pro-Chancellor, NITTE, deemed to be University, Vice Chancellor, Professor Dr. M.S. Munitaya, Sir, respected Dr. N. SRIDHAR Shetty, Founder, Principal, A.B. Shetty Memorial Institute of Dental Science, heads of the institutions, faculty members, invited guests, alumni, former principal, Professor Dr. Rajendra Prasad, Professor Dr. S.M. Sharma, and my fellow alumni and my dear students, wishing you all a very good morning. It's indeed my pleasure to welcome you all to Professor Dr. N. SRIDHAR Shetty Endowment Lecture to be delivered by Professor Dr. Paul C. Salins. Both Dr. SRIDHAR Shetty and Dr. Paul Salins, both of them were my teachers and mentors. Dr. SRIDHAR Shetty, who was a founder principal, A.B. Shetty Memorial Institute of Dental Science, ex-president, Dental Council of India, and a teacher who served this institute as a principal from 1985 to 2006. I am sure you had a good learning experience with his talk, The Legend Speaks, today morning. This endowment is an honor of Dr. N. SRIDHAR Shetty, is an expression of his gratitude, to the visionary, academician and mentor who has contributed immensely to the growth of dentistry as a whole and especially to A.B. Shetty Memorial Institute of Dental Science. The theme of today's oration, the architecture of becoming, a journey through dentistry, surgery, healthcare, and developing synthetic intelligence. In academia and healthcare, our journeys are not defined only by achievements, but also by the values that we pass on to the students. We mentor the lives, we influence our students, and every educator becomes a guiding light for the future generations. And I have seen the guiding light on the dais and a few of my teachers of the dais and my colleagues of the dais. The alumni of our institute have installed this endowment lecture which began in 2011, and this is a 12th oration lecture, and I, being a student of Dr. N. SRIDHAR Shetty, take this opportunity to express my gratitude to all his contributions in my successes. It is my privilege as a principal of this institution, and on behalf of A.B. Shetty Memorial Institute of Dental Science, I extend a warm welcome to Dr. N. SRIDHAR Shetty, and I request Dr. Chetan to welcome Dr. SRIDHAR Shetty with a sapling. Dr. Paul Salins, Medical Director, Senior Vice President, Narayana Healthcare, Majumdar Shah, Multi-Speciality Medical and Cancer Center. Sir is a celebrated achiever. His presence here today is like an inspiration to each one of us. All his achievements will be read after this welcome address, but personally, I know Dr. Paul Salins as my teacher way back in 1988 to 90. Even though I remember we had the best of the teachers, headed by Dr. Rajendra Prasad in oral surgery, Dr. Sharma, and we had visiting professors, Dr. Paul Salins and Dr. Kishore Naik, who were there for us to teach the techniques. I still remember those days when I was taught impaction by Dr. Paul Salins. I was taught suturing technique by him. And even now when I suture, my assistants really admire me. And remember, those days he demonstrated, he saw how I was doing it, then he corrected, and then he again observed what we were doing. So the major teaching learning program that we had way back in 80s was what we are today. So thank you, sir. And I always remember my teachers, because all the success stories that we talk about, the foundation were laid in this institution by our teachers. More than that, I think orthognathic surgery was first started by Dr. Paul Salins, sir, as I remember. We had orthognathic surgery in Padma Shri Hospital, and we used to assist. We had a very good HOD, Dr. Rajendra Prasad sir, who used to send us for assisting any cases. So we had a privilege as undergraduate students to assist cases. And those days, we were very proud of a teacher who found an access to the floor of the brain through the maxilla. And he was very famous for that those days. I'm talking about 80s. So he had an approach to the unapproachable areas of the brain through the floor of the maxilla. So the floor of the brain, that is the maxilla, and we remember that, and that was a discussion of the students those days. So I do not know, there must be many, many more achievements which I do not know, which will be read out right now. So being the first batch students, that was the advantage we had. We had the teachers all for us and no seniors. And we had the best of the visiting professors coming in to teach us, and one of them were Dr. Paul Salins. We welcome you back, sir, to A.B. Shetty Memorial Institute of Dental Sciences, and thank you for accepting this invitation and being here today. And I request Dr. Amita Ramesh to give a floral welcome to Dr. Paul Salins. Vice Chancellor, NITTE deemed to be university. Thank you, sir, for all the support and guidance in organizing this program. And on behalf of A.B. Shetty Memorial Institute of Dental Sciences, I welcome you to this oration lecture. I would like to put on record a special welcome to Professor Dr. Rajendra Prasad, our former principal and my teacher, who has been there right from the inception of the college. Thank you, sir, for your presence. Professor Dr. S.M. Sharma, sir, thank you for your presence. Sir is also a teacher right from inception. He is a part of this institution. And I can see my junior, Dr. Gopakumar, who's been here, Dr. Neelan, then I can see Dr. Tirumurti, Dr. Amarnath. I think there are many more alumni who are here in this gathering. Thank you very much for making time to be here today. And it makes a difference when the alumni come back to the alma mater. I take this opportunity to welcome all the heads of the department, all the faculty members, the press and media, and most importantly, my undergraduates and postgraduate students who are eager to listen to the oration lecture. I am sure this program would be a memorable one. Thank you to each one of you. Thank you.
And the speaker for the day for today's endowment lecture. Today's endowment lecture provides us with a unique opportunity to learn whose experience, knowledge, and vision continues to shape our profession. Dr. Paul C. Salins is an internationally acclaimed innovator whose work integrates craniomaxillofacial surgery, translation medicine, and artificial intelligence. He currently serves as the Managing Director of the Mazumdar Shaw Medical Foundation, where he provides strategic leadership in advancing healthcare, research, and innovation. A leader in craniomaxillofacial and reconstructive surgery, he has developed innovative orthomorphic surgical techniques and advanced protocols for skull-base access, facial asymmetry corrections, and hard and soft tissue reconstructions, significantly improving functions and aesthetic outcomes. He is the originator of interceptive therapeutics, a novel paradigm that bridges preventive and disease-focused medicine by combining AI-enabled diagnostics with multi-targeted pharmacology to prevent, arrest, and reverse chronic lifestyle and aging-related diseases. Professor Salins also pioneers the artificial intelligence, machine learning driven computational science, developing predictive analytics and machine learning models for complex biomedical data. An ardent patron of art, architecture, and classical music, Professor Salins exemplifies an interdisciplinary vision, seamlessly connecting medicine, technology, and the humanities to inspire innovation. He has several awards and recognitions to his name. He was awarded the Legend in Dentistry Award by Global Academic Conclave at the PMS College of Dental Sciences and Research, a Lifetime Achievement Award from Savita University, Chennai, the Kanagaraj Senior Fellowship Award from the Indian Society of Dental Research. He also delivered the prestigious R. Ahmed Oration at the 61st National Meeting of the Indian Dental Association, the Government of Gujarat Appreciation Award for dedicated medical services during the Gujarat earthquake, and also the Outstanding Teacher and Educationist Award from the Association of Oral and Maxillofacial Surgeons of India, to name a few. These accolades reflect Professor Salins' enduring commitment to clinical excellence, pioneering research, surgical innovation, academic leadership, and humanitarian services. Today's endowment lecture is titled The Architecture of Becoming, a journey through dentistry, surgery, and healthcare, and developing synergetic intelligence. It explores how innovation, lifetime learning, and emerging technologies are reshaping the future of dentistry. Through his journey, Professor Salins will share insights into integral clinical excellence with advances in healthcare and artificial intelligence, inspiring dental professionals to embrace new possibilities in patient care, research, and education. Please join me in extending a worthy welcome to our distinguished speaker, Dr. Salins. He shall now deliver the oration lecture.
Good morning, everyone. It's indeed a great honor and privilege to be here at A.B. Shetty Memorial Institute of Dental Sciences, NITTE, deemed to be university, to deliver the Professor N. SRIDHAR Shetty Endowment Lecture. At the outset, I would like to express my sincere gratitude to the leadership of NITTE University and ABMS IDS for this kind invitation. I deem it a great privilege to share the dais with Professor Shantaram Shetty, Honorable Pro-Chancellor, Professor M.S. Mudataya, the Honorable Vice-Chancellor, the Professor Dr. Harsha Halahalli, Honorable Registrar, my old student, I am so delighted, Dr. Mitra Hegde, and faculty members, distinguished alumni, dear students, ladies and gentlemen, and I should not forget Rajendra Prasad and my dear friend and Sharma. I already so delighted to see him, my first student here in A.B. Shetty. It's really a great privilege. I'm going to actually be speaking about architecture of becoming. Next one. So it's a great privilege for me to give this lecture, because when I actually came to, so many years ago, to A.B. Shetty, it was in a in a rented building. I had come from abroad and worked in different countries, so I really. But what amazed me at that time was the enthusiasm and the vision plan he had. Even in oral surgery, in those days, he introduced sterilization. People had to wear masks, and this one, in those days, we were not even using gloves, I think, if you remember correctly. He was the first one to actually introduce. So, you see, a person's thought process, how far in the future his viewpoint is, ultimately determines the whole spectrum of the development. Today, when I walk through the corridors of this institution and how this has flourished and come to be, and those of us who have actually seen it in the early days, you can see that the tremendous amount of progress has done. But it is in some way the vision he actually espoused at that time. Whenever he got to his office, I deliberately put this picture. You will see so much of advice written on it. In fact, before he started talking to you alone, you were inundated with advice. Now, the point of the matter is this, that all these things he actually absorbed into his own self, and over a period of time, by some persuasion and perseverance, he has managed to achieve. And it is so wonderful for me to see this great institution. And Dr. Mitra was telling me, about how this has expanded and the facilities that you have. I really look forward to seeing this. Thank you very much. Now this is where all it started. I still remember the first floor he used to have his office, isn't it? And at the top he used to have a canteen. Can you imagine this building and where we are now, and in this conference room? At that particular point in time actually shows that is vision. I actually made this lecture because when I was thinking about Dr. SRIDHAR Shetty and the contribution he has made, in fact, very often, this was actually done by Michelangelo, because he found a lot of people who were doing extremely talented people. It is not that they did not possess the talent to achieve the things that he did, but as soon as they reached, their points shifted towards what was immediately possible, just getting some money or getting something that is actually security particularly. So this pursuit of security made them actually not attempt risky things. As a consequence, all their life, he really felt they had extraordinary capable. Then came Raphael, as you probably know, who actually challenged him only, because he actually brought in a new generation of thought and processes. So young people here, I thought you should keep this in mind. Now I will actually slightly change the context. The architecture of becoming, really, when we really begin to consider, I learned something extraordinary. I now work with very advanced technology, a hospital and a hospital setup with multiple things. Whenever I see what we achieved today with all the facilities that are given, and what in earlier days my mother came after many years in government service, became the first Indian to become the medical director of the Udupi Mission Hospital. Now, two things that actually I tell our people very often. The mission hospitals at the time were very happy places. They were a place of hope. Now, even in our institutions, when a patient goes, including me, if you actually fall ill and go to the hospital, they are not able to project that mood of hope, the mood of being cared for, that the mission hospitals created. I used to go and play all the time in the mission hospital because my mother was there, and the people were all very caring people. In fact, what she did was, she actually brought there was an orphanage with a lot of ladies. They were actually brought in and actually made into nurses. They were all trained by these Germans, and they became extraordinary caring nurses. To this day, the legacy of that. So why I tell you this is, with artificial intelligence and with the advanced technology, the trend is shifting. Many of the skills and the experience that characterized each of us, which made us very distinct, will be lost. Because memory will not be necessary, because information will be readily available through the artificial intelligence. Complexity will be resolved. Skill again. In fact, I have already seen extraordinary robots which can do unbelievable amount of retinal surgery, far beyond what a human being can do. In dentistry, there are already robotic apparatus which are able to do with a degree of precision that even in cases where a human being cannot actually put an implant, they are able to do it and do procedures with such delicacy. Now, in this particular phase where your life will change with artificial intelligence, what will become far more important than the mere ability to understand, remember, and acquire basic skills is this ability for empathy, human understanding, to communicate your concern to the others. What we miss today in our hospital, as a medical director, I can tell you that what we miss is this human bonding that I learned in the Udupi Mission Hospital. You know, they really lived the words of Jesus, that they saw God in the patient. Now, whichever way you look at it, and the communication and the comfort, and really if I look at it today, able to provide are no less than the results. We might have greater medicines, but the overall transformation they brought in the life of the patients is something that we have to learn from. I put this at the very beginning just to tell all of us, to remind ourselves that the next shift in science, in medical science that will take place, will be actually increase the role of technology and give an opportunity for us to actually recover the role that was previously that of these people like them. And one of the great things I learned from mother is that the clinicians of the older time, they actually had the capacity to see and perceive and understand. Now today, one of the big complaints I have is all of you probably, as soon as a problem comes, you look at the lab tests, you look at the investigation reports, you look at the CT, and very often you miss the complexity that is something beyond the investigations that we'll do. That is what is intuitive artificial. This picture I am very fond of. In this picture, somebody is actually explaining a very complex machinery. And you will see, if you see the picture very carefully, the intensity with which somebody is trying to understand and grasp is only one person. That is His Holiness the Dalai Lama. You will find, his head is turned towards the degree of concentration. We no longer give this degree of concentration and consideration to our patients. That is the single most important. If you actually observe your patients with this level of intensity, you see things which cannot even an investigative modality can do. Now I will come to that afterwards. With artificial intelligence, we are able to detect, and also I put a reference there for you people to know. Study shows that humans can actually perceive. My sister always did this before the time of the ultrasound. My mother would just palpate like this and she will make out the spleen is enlarged, liver is enlarged, this one, that. And we always wondered how she was able to do it. And it is not, see, I sometimes press very hard the abdomen to feel whether you can see the splenic flexure or whatever it is. But in those days, that is because they had developed the capacity to grasp something beyond, and also the psychological capability. In fact, my mother would say that this particular patient, she will not do well. She will be telling my father. It is because they knew the whole family. They knew that in that family, if they got tuberculosis, they will not be able to respond. Cultivate the human capability to a point where you can really deliver care beyond the ordinary was a quality that we have lost, and this is an opportunity for us to recover. See, seeing, I just put this picture to know. Usually in the picture at the other corner you can see, even when we are actually listening to somebody, most of the time our mind is here and there. But if you really look at this, this is an ordinary bust of Cleopatra, or this one. Now, if you see the picture there, that is the number of points when somebody is actually grasping the picture, how much the eye moves. In fact, it is actually the tracing of the movement of the eye and the way in which the three-dimensionality of it is absorbed. Now, currently, many of them are going to become maxillofacial or craniofacial or head and neck surgeons or clinicians of whatever rhyme or color. But unless you develop the discipline of the eye to actually look and perceive and grasp, you will never be a clinician. You might have all the investigation modalities, but the thing that will make a qualitative difference in your ability to care for a patient will be simply lost because you lack that ability. One of the very major factors that will become a dominant feature of the future for educating the mind, as you go more and more from the classical approaches of education towards the complexity which you will have to understand through engineering with artificial intelligence, is art. See, there are very few ways in which you can actually increase the number of connections within your brain and how you can actually engage with handling complexity. The reason is, most of us, without exception, I think, do four things. Whenever a complex problem is given, whether it is clinical or anything, the brain tries to reduce the cognitive load. most of the things we simplify. Whatever you try to understand, we do not have. Now, in everything, when simplify complex things, and we use abstractions, heuristics. So ultimately, what you are actually is capturing only a fraction of the actual reality that is there. One of the very big elements in which artificial intelligence is moving, why it is so dangerous, is that this elimination of large amount of data. That means when I speak, suppose you do a CT or an MRI, the quantum of data actually goes, that is before it is translated into an anatomical figure, you lose about 80 to 85% of the data in actually converting it into a form that is interpretable by human beings. So essentially you have an enormous amount of, same thing, a ECG, if it is actually coming to it only on a waveform, you are losing a tremendous, because we have to simplify it for human understanding. Numericals, images, and all these things. But artificial intelligence can actually do it without that. Secondly, we divide problems into manageable fragments. Biggest problem in medicine is that we have super specialties, and each super specialty has domains. That means the cardiac is one side, cardiopulmonary, but the body does not function that way. You know, there is a seamless interaction between the systems. And that is second, because we actually fragment and understand. Even let us consider dentistry. We have periodontal operative interactions. In fact, we forget that everything ultimately has to be considered in a total context. Even a contour of this one actually has an effect all the way to the temperamental joint and all the way to the psychology. Then finally we use identify thresholds and we use infrastructure of ideas. I think I really urge you to look at it very carefully, because this is the one which will actually challenge you, young people. Your future will be greatly challenged by these four things, because these are the four things which will be replaced in the future in the artificial intelligence, which will become the basis of some of the biggest problems. Whenever you have image through art, you will see we are all accustomed to simplified pictures. You can get a lot of sophistication simplified pictures which we can understand. Most of us, our intellect stops at this level of analysis. That means we like to see pictures which depict what we know, what we understand. We do not go beyond it. Only in art, you begin to see, now here there are three pictures of the facial image. One is by Rembrandt, another is by Matisse, and another by Schiele. Now you will see in all the three, the human figure is completely, it's a totally different vocabulary of representation. Now, why is it so very important that you have to learn to appreciate the subtlety that is involved in the ways are going through? Because when you see and compare and contrast and develop an appreciation for this type of variation in art, because in most of your clinical practice, in all that we do in day-to-day life, what we really have is repeatability. You do not have diversity. We like to actually bring down everything to the same framework of thought. While only in art and in complex music, it actually metamorphoses into ways which become extreme. Now these things, once you learn an appreciation, you begin to actually find that it will start making complex pathways within your brain, which makes it possible for you to negotiate much more complex problems. That's why a person who can actually negotiate and understand poetry is likely to be far more sophisticated in his thinking capability. Now, see, I deliberately put all the possible ways in which it can be expressed. Similarly, in the different forms. See, there is so much of variation and diversity that the brain. See, when we were building, I had never built a 1,000-bed, 550,000 square feet building. So when Dr. Devi Shetty and Kiran Mazumdar asked me to come and start, I thought there will be a building and I will be coming as medical director. But I got much by shock. They told me, no, you have to sit and start planning and conceiving. And of course, Dr. Devi Shetty is a surgeon, you can communicate. But Kiran Mazumdar, very difficult. You know, how? Because she really, That time I actually drew a picture. What you see on the right side is a black and white. I actually put the whole thought process of this 550,000 square feet building that I was struggling to actually realize in a thought process. At Harvard, subsequently, I repeated it. Then I told our team members, whenever you actually have something bugging you, come and paint a little bit on this structure. And I started at the top with the blue and so on and so forth. Now, if you come to my office, there is a painting which is worth a few crores. Okay, a few crores. And this is a composite picture. Why is it a composite picture? Because it is very complex. When Muhammad Yunus, the Nobel laureate, came to my office, he asked for a chair and sat before it for a very, very long time. So many times we get Nobel laureates and so on, so coming through. And it is. Now, what you actually see is the way how the brain is trying to engage and it finds it. That's why art is a easiest way in which you can actually develop complexity of thinking. I will just go into it, but you do not have to do. There are a lot of studies that has been done how art transforms your brain. It is just sufficient for you that there's a lot of work. And even the musicians, particularly not just listening to a tune, if you can understand Bach or a complex Hindustani music or a Carnatic music where variations are created, and then you find that it actually automatically engages your mind in ways that it becomes extremely powerful. Now, I want you to read this very carefully. See, when Steve Jobs was actually creating Apple, he was against tremendous competition. Okay, how do you create, when Microsoft is so powerful, how are you going to actually create? So what he did was, see, in Apple, he says the DNA for the Apple technology alone is, it is in Apple's DNA that technology alone is not, or competence, knowledge, degrees is not enough. It is technology married with liberal arts, married with humanities that yields us the results that make our hearts sing. Now what he said, part of what made the Macintosh great was that the people working on it were musicians, poets, artists and zoologists and historians who also happened to be the best computer scientists in the world. But if you make time for liberal arts, not only will you become a more interesting person, you can find that little something that will differentiate you from everyone else. And I'll tell you, if you come to our hospital, there is an extraordinary painting. In fact, when we actually, all the research, we got a huge research center. When Kiran Mazumdar gave me the funding, we created a small amphitheater, something like this. And it's a circular one. I copied it and I put a copied painting. I actually gave a lot of money to an artist to paint the Raphael's copy and put it there. So when she came, there was this. She said, no, take this out, Paul. You have to actually articulate the thought you have for this institution and create an art that is unique. It should not be like anything in the world. So unfortunately, I did not put it here. Later on, I can show you. So what I did, I actually created a composite picture. I sat with the computer people and created a massive picture with a planet. Planet is superimposed with the Bach's Art of the Fugue, which is the last piece of music he wrote before he died. One of the most complex pieces of music were the musical architecture. On the top of that, Vitruvian Man by Leonardo da Vinci. On the top of that, the first diagram of the brain that was drawn. First, when the structure of the brain was understood. You must understand brain liquefies. To understand the structure was a huge, he got the Nobel Prize for it. And then the alpha helix, the story of alpha helix is unbelievable. How at night he actually imagined it folding and he actually got it. And the double helix, which actually it is, and the hemoglobin molecule. Then what I told was that every time we have a Nobel laureate or somebody who has made a real contribution to medicine and surgery or art and history, they should come and draw their thought into that picture. If you come to our hospital, we have another picture next to that, which is again a timeless piece where we cannot actually measure the value of it. It is this. So many. The first art that was on top of it drawn was Harold Vermas, who got the Nobel Prize for viral incidence of cancer. Now, every time we have a scientist or artist, they draw on it, now it has become a composite. Now, why I tell you this is very important that you young people develop this way of thinking about it. I mean, we can actually go into it. There are two things, executive control and spontaneous thinking. I think I really urge the younger generation to really consider, because you will face challenges which can be only understood. You can apply very dryly in surgery. This is a lecture I gave to the Institute of Statistics at Verona. I actually converted the facial skeleton. How I was able to do many of the procedures was into architectural elements, structural elements. What are the things which actually constitute the stomatognathia apparatus? From that, see, like this. Then from that, we were able to actually develop the methods to transpose the different, this became a major paper and so on and so forth. It's not very important that you see the specific one. Now, of course, we have extremely precise surgical methods which we can do that, and we can reconstruct them in ways which are unthinkable before. For instance, we use rib. Normally, rib will resorb. But if you preserve the kinetics of the rib precisely, you are actually able to make it live. So you can see that how I have reconstructed the patient. See, she even has teeth. See, this is another case. I think you probably might have seen, because I did not bother to check. But see, you will find that it is. Then again, we are actually using. See, in all these cases, what you see is that it's the architectural and engineering concepts that are actually brought in, so it becomes possible for us to do. Now, recently, if you read the International Journal, I actually created another way. I actually worked out that in sleep apnea, very often when the tongue looks very big, it is not that the tongue actually is big. So, if you do, the reason I did it was, I realized that you can keep on reducing the size of the tongue, but it will not correct your sleep apnea. Tongue gets pushed out. So what you see as a big tongue is actually a reduced the intramandibular space. So this technique I developed, which is now published in the International Journal, it has come in the last one, dramatic improvement. In fact, the patients will fall at your feet. Now you will see, in a case like this, you will not believe that a rib graft will work, but you will see that, I have used a rib graft, implants have been put, and this is how she is an Ethiopian patient. And, because I had failed in, I was a bit of a failure. I failed in SLC, I think. I failed in PUC and all that. So she thought it's very useless boy. Anyway, be it as it may, when I came to Manipal, and then again I failed in pre-medical. Again I failed in chemistry. So it was not going very well. Okay. Then I met TMA Pai, because my mother knew it. What characterized him was, actually I'm telling you, you should meet. He actually was like a child. There was a bubbling enthusiasm about the man. In fact, I did not actually notice with Ramdas Pai that capacity to move. He would bring, one day I remember, he brought a silver kadga. Somebody has donated him a silver kadga and he gave, hold this. So we were all holding the silver kadga. He said, you also should get the feeling of this. One day somebody should give you, why silver kadga? Chinnad kadga kodbe, gotaita. He used to tell us. Really, he imbibed. Those of us, we were very bad students going about, really. But whenever he came, he put the spark of possibility into our brains. And if you read this one, it says, somebody might not be good. It might be not be a first-class specialty. It does not matter in the least. You can actually turn to advantage. So I am always grateful to the to the experience that I had. This is Manipal, the dental college in those days. Before that, we had either Revati's sister. If somebody from early days of Manipal, you will remember it. This is the first operation we did in orthodontic surgery that we did in Manipal, and with the remarkable. Now this is the time before nobody knew what is orthodontic surgery. Now it's all very common. So I just put it so that you actually get an understanding. This is another patient. Okay, and the first microvascular, I tell you, this is much before people even talked about microvascular surgery. And this, when I came to Dharwad, this is the Dharwad, the team. In Dharwad when I came, one great lesson I learned that you should never look for it. I could not, the very primitive. In fact, nothing actually prepared me to say FS. We did not have a hospital, we did not have medical support, we did not have anything of the sort. Even the blood tests and everything, our postgraduates in MDS postgraduates has to do it. Because I used to, we trained them to do cross-matching and all that. Because of that, they all became extraordinary. All the people there, are doing everything. So then we did a lot of, publication. This bursitis new syndrome, I discovered it because I had seen, when I was a house surgeon, a rare case. But it took me 10 years to understand what that cause was, the problem behind that case was. I realized, because the bursitis had never been known before. So that is what I wrote. And then I thought, then it became. Then we also actually, with, this is, you can see Dr. Sharma and Rajendra Prasad, how young he was. And, and ಅದು ಶರ್ಮರೆ ಅವರಿಬ್ಬರದ್ದು ಹೆಸರು ಎಂಥದ್ದು ಮ್ಯಾಥ್ಯೂ ಕರೆಕ್ಟ್ ಹೌದು No, really, this picture makes us all very, very happy, I tell you. ಹೌದು ಜಾನ್ ಜಕರಿಯಾ, correct. Really, we should, it makes us very happy. This is very old picture. Do you know, that time, ಹೌದು ಅದು ರಾಜೇಂದ್ರ ಪ್ರಸಾದ್ ಇದ್ದಾರಲ್ಲ ಅಲ್ಲಿ, ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ಶೆಟ್ಟಿ ಗಾಟ್ ಅಸ್ what's it called, a blood sugar machine. It was just introduced. Then one day Sharma, I had to actually work out what was his thesis subject. So I said, what thesis you will do? I said, you cannot do this cephalometric and all this sort of nonsense. You have to do something original. What? Then he told me, Allah sir, tumma mandi alli Vednak hospital, lot of people are fainting. So we said, anyway, we have blood sugar. I have always suspected that the fall in blood pressure alone is not the factor in. So we did a profound study, a physiological study, studying blood sugar fall. How the parasympathetic dominates in these patients, and this is all. Actually, it is one of the best studies even today. It is a classic study in syncope. It is blood sugar, hypotension, blood sugar synergy, hypoglycemic synergy in this one. And how they ought to, see, this is the one. We actually showed how it is correspondence. Then of course there's orbital and so on and so forth. It is. Then anyway, I'm come to the end of my talk. But now what happened was, now you will see, I have also the patent on intuitive artificial intelligence. It's called the patent on synthetic cognition and intuitive artificial intelligence. And now we work with quantum computing and so on and so forth. What I want to really show you is that during the COVID time, I started looking at the problems that was in the hospital with a lot of people. I noticed that in the ICU so much of data was coming through. But the decisions were made only on small data sets which are shifted. Okay, so in 3 or 4 patients, you will find some thresholds have shifted. Now I realized that although you treated depending upon the threshold shifts were not necessarily because of the same reason in different patients. You might have a fall in blood pressure in one patient, that is the threshold shift. But the cause of it could be very different in one patient, in another. We were not capturing the sum total of the data, we were going by only few data sets. So I actually moved forward. I developed, anyway, it's long and short, you do not have to worry about it. But the point of the matter is that what I did was I started actually converting data into shapes, and you can see here all the data actually is moving into, can you make out? That all moves into different shapes. So I developed a system of data morphology. You do not have to worry about it. The point I'm trying to tell you is that you have to find newer ways of solving problems. That is the most important thing. And now we actually have come up with a quantum signature. It's a quantum simulation signature which encapsulates, it is 878 parameters. So, and you also have a 3D representation. So each one of us, like our genomic signature, also have an electrical signature, which can be recorded today and followed up if you are obese, if you lose it, or whatever you do. And it becomes also, if you see that you are going downhill, you can actually make out. Anyway, so through this, you can see, this is a World Series we have done. So you can see how this is with quantum computing. If you are at the top in that green line, usually it's very healthy people who are actually people who less than 20-year-old people, they will actually follow into that. And while if you come down, there are people who have cardiomyopathy or other problems and this and so forth. So, you can identify where you stand. From that you can actually develop. Anyway, it stands from normal to healthy over time. And this is the quantum correlate visuals you can create it. Anyway, I will end this lecture. I think I have taken very long time, I think. But 5 fellow. First of all, please, you might be dental or you might be anything. Do not let your profession be a boundary. You act as though, oh, I'm a dentist, I should always go and open a clinic and do it. No, who's told you? You can actually become a nuclear scientist. Nothing stopping you from that. I actually think like that. I never actually allowed my qualifications to determine what I am doing. As a foundation, use it that you have just understood the vocabulary of functioning. 2, let purpose and not circumstance define what your life would be. We will be just doing some extractions and sitting there. I went and said, okay, we'll do block dissections and everything like this. So you should see what possibilities lie, not what the limitations that you have. Second, number 3, never stop becoming a student. I always felt that, we become very proud. See, if you are proud, it is a sure definition that you have limited knowledge or limited capability. Pride is a defense reaction to protect the little that you have, not the understanding of what you possibly can achieve. That is why, always remember, if you are humble, you will be able to actually absorb tremendous. Humility expands possibility. And every ending can become a new beginning. In my life, in fact, there's a beautiful, please go back and see, I ending with it. When Chief Justice Roberts of the United States Court, his son's college, they asked him to come and give a valedictory lecture. And do you know what he said? He came and told the lecture, I wish you bad luck, ladies and gentlemen, he said. That is the theme of his lecture. Please go. I wish you bad luck lecture by Justice Roberts. Please check it on this one and listen to it. He actually shows that the greatest opportunities, greatest lessons, and greatest change in somebody's life has come because of failure. Something had limited. In my life, when I got kicked out of Dharwad, I jumped into Qatar and then came to Narayana. So every time I have found, if I had actually continued in the complacency, I would probably not actually reach. So all of you, do not be afraid. Even today, I have a lot of corporate challenges and problems. Yesterday, till evening, till I got to the airport also, I was problem solving. So much so, my brain was completely fried, actually, tell the truth, because it's all finances and equity and this and that, and very, very huge and with very difficult people. Now, I'll tell you, with God's help, all things are possible. Every day, I actually get up and I pray for my patients and from all the people that I'm likely to meet, and that becomes a wonderful beginning for you to start. And don't limit yourself. And so I end with this message. What we have seen here when I come here to give this Dr. SRIDHAR Shetty Endowment lecture is, long time ago I came to a rented building and saw a man with a huge dream. And that time it seemed so impractical to me, because having sterilization and all that, because we had very primitive facility. But he had already thought that this has to be, he was not imagining the limitation that was there, but the possibility. And today when I come to see what you people actually have and own, I begin to see, and I asked myself, with this beginning, what possible, you are already on the shoulder of giants. What sort of a progress, what sort of a college, what sort of an institution, and what sort of a life for the future you can achieve. And I wish that, and I pray that God will give you all the wisdom, and really I hope that some of you will at least will take my advice and reach for the skies. Thank you very much.
The audience today, because it is in the name of a visionary leader. You are having an erudite lecture by a great achiever from your field, and I am here just to be part of that event. The president of today's special occasion, Dr. SRIDHAR Shetty, Dr. SRIDHAR Shetty, in whose name this endowment lecture is arranged. Our distinguished speaker for the day, Dr. Paul Salins, with whom I had the pleasure of interacting with him. Starting from 2012, I had been to his place. He organized for a collaborative initiative with a German university. So with our Vice Chancellor as the registrar, I was with him at Ooty to get that MOU signed with that university. And Professor Mitra Hegde, the principal, all our learned colleagues, all invitees, young student friends, ladies and gentlemen. Sometimes when I am with the doctors and surgeons, sometimes I get a feeling that all of them have taken over my area, namely management. They all speak about strategic management, they speak about finance, they speak about arts, they speak about humanities and so many other areas. And I'm very happy that today's special lecture is on a theme that's quite relevant to you, and his lecture has opened all our eyes. And one thing that he has been advocating to all the young student friends is that dream big and make it happen. And while doing so, he said, people succeed not because of the facilities, but in spite of the facilities. If you're in a position to see resources around you when you don't have it, there is no doubt, undoubtedly you will become a great leader and you will become a great achiever. I've been just taking down notes as he was presenting his lecture, and four or five important themes that he has been mentioning. I think our young student friends should take it back home and should practice in life. Point number one, multidisciplinary approach. This is very, very important. You can't work in silos, and in today's contemporary globalized environment, if you are to succeed, it is essential to believe that you need to look beyond your space of operation. And therefore, having a multidisciplinary approach is very, very important. And he also spoke about the mind and heart working together. This is another important thing. What generally happens is, when we become a specialist in a given area, we tend to ignore the fact that we have something to learn from arts, something to general sciences, and so many other architecture, and so on. So what's important is success in a chosen field also calls for the bringing together mind and the heart. He also spoke about taming the technology. He spoke about artificial intelligence, synthetic biology that is coming up in a very big way. And I had the pleasure of participating in a 4-day rather certification program on advanced artificial intelligence recently. And this was organized by Tufts University, USA, and also Indian Institute of Technology, Kharagpur, and a Japanese university together. Mind-blowing things are happening in the field of science and technology. Artificial intelligence, which is based on natural intelligence of each and every one of us, now is creating big challenges for the humanity, and you find that unless you are in a position to tame technology to your advantage, you will not be in a position to survive in the days to come. It is worth noting, and you have to be very careful while using the artificial intelligence also. Whichever tool you are using, ChatGPT or Google Gemini, Claude or Perplexity, whatsoever you are using, what generally happens is, especially when you make use of the paid form, you pay for the tool, and after that what happens is very, very important. When you use your intelligence, your information, your technology and your know-how with those tools, what happens is there becomes a double payment. That is, you are also enriching that tool. And based on that becomes more powerful, and those days I'm really concerned and worried what will happen in the days to come when the artificial intelligence poses challenges to our natural intelligence. Well, but then using that, being away from that is not at all a solution. That's what he has been telling. Also, he said that if you are to be successful, you need to create a differentiator for yourself. And this differentiator, one of the important factors that comes to your help is your humility. And when you succeed, as you become more and more humble, you become more deserved. And as a result of that, you will be in a position to really handle your success, and life becomes more enjoyable. And it is my proud privilege and duty to thank Professor Paul Salins for making this day memorable, for delivering a wonderful lecture. What a great dreamer Dr. SRIDHAR Shetty started is being continued through this endowment lecture. More and more achievers are coming to the university and addressing our colleagues and student friends, and I'm sure that this would be a great inspiration. Both the speaker and the person on whose name this endowment lecture is organized, they will continue to inspire all of us. On behalf of the university, I wish to thank both of them and all the office bearers from the college who ensured that this excellent lecture is organized here. Thank you once again. Thank you, ladies and gentlemen.
Our esteemed guest of the day, Professor SRIDHAR Shetty Endowment Lecture, orator, a surgeon who has made an international fame in maxillofacial surgery, and he shifted on to the base of the skull and made an indelible mark as a surgeon of repute. And we are very proud that he was one of our staff members from 1988 to 1990. We call him, the dental surgeons all around the country call him one and only Dr. Paul. The person who is responsible for all of us to be here, my good friend, colleague, we hail from the same place, and I have learned many things from him on administration, Dr. SRIDHAR Shetty, our Vice Chancellor, Professor Mudithaya, the First Lady Principal of our Institute for the last 46 years, the charming Dr. Mitra Hegde, Dr. Ravi, our Vice Principal, Dr. Rahul,
I see the galaxy of past principal, Dr. Rajendra Prasad, Dr. Sharma, Dr. Murthy, Dr. Gop Kumar. I always remember him as a Gopinath, Gop Kumar and Shuma. Members of the staff, dear students, ladies and gentlemen, I consider it indeed a privilege and also a great pleasure to preside over this function of oration named after Dr. SRIDHAR Shetty. This oration is rather unique, that many of the orations which you see in many of our associations or in institutions or in universities are endowed by a particular, either the children or the parents or by the institution itself. This endowment is rather very special because all the students of Dr. SRIDHAR Shetty have joined together and endowed this particular lecture. That itself shows how dear he was to the students and carried on his aims. SRIDHAR Shetty is a rare blend, as was rightly told by our MC, a researcher, a good teacher, a talented prosthodontist, more than all, an administrator. He might have been very harsh to some students, even to the staff, but I was told the students went after his harshness. The more he shouted at a student, he was sure to pass in the examination. So that was his administration tactics. I should share this one incident. This happened way back. Dr. Salins showed those beautiful slides where the college started in Bunch Hostel, then shifted to the Mr. Naik's building. And this was in, as I remember, in 80s. I was driving down in my car and I suddenly saw Dr. Bhaskar Shetty getting out of the building, Naik's building, and running to the road. I didn't know what happened. I put my brakes and started. He was chasing a student around. And they went round the bus, and after 2 rounds, as the student was very intelligent, he turned around the other way, but SRIDHAR Shetty was more intelligent. He also turned and caught him. That was Dr. SRIDHAR Shetty. He had his own administrative tactics, and Dr. Salins also showed that building a rented building way back in 90s, which has been transformed to this magnificent 7-floored building today. And I'm very proud to say, Dr. Salins, I have gone to many medical institutions and even dental colleges. I'm very proud to say this is one of the A.B. Shetty Memorial Institute. Much of the credit goes to this great man, and it is but natural that students have really placed this name to everlast. This started in 2011, and this is the 15th year we have this endowment lecture. Thank you, Dr. Mitra, for continuing this tradition, and all of you students. And I see the galaxy of principals. And I was told out of the 362 dental colleges in the country, 18 principals are from A.B. Shetty Memorial Institute, which is perhaps a record by itself, and perhaps a record which is difficult to aim. Dr. Salins put his first slide after Michelangelo. He said the danger is not in aiming, not in failing the greatest of aims which you have, but the shame is that you do not aim higher. So that is, he aimed and he got it. And it was the help of all the staff put together. Congratulations to each one of you who have made it possible for us all of to be here. And really, we appreciate the great words of Dr. Paul. In his own inimitable way, he has mentioned the importance of science, the importance of art. And to me, yes, science and art, with that, the humility which is mentioned, and the eye and the communication skills which can endow itself is equally important. Coming to his talent in maxillofacial surgery and the base of the skull, I must share this small thought to you. I was in my anatomy examination. You know, those days anatomy results were only 20% in Mysore Medical College. That is, only one student out of 5 would pass. And I got into the examination practical, and we were to pick up what dissection you will have to pick up. I got the posterior triangle of the neck. I did not know whether it is anterior or posterior triangle of the neck. And luckily, there was an invigilator who was as kind as Dr. SRIDHAR Shetty, Dr. Zahir. He used to play tennis with us. And I straight off went to, I had the guts of Dr. SRIDHAR Shetty. I straight off went to Dr. Zahir and told him, if you want to fail me, you give me that posterior triangle of the neck. Please give me a chance to pick up one more. He looked around, nobody was seeing. All right, you pick up, he said, quickly. I picked up, I got the cubital fossa. That's how I became an orthopedic surgeon, because it is so difficult to be anywhere in the neck. The most difficult part of the human anatomy is the base of the skull and around the neck. Congratulations, Dr. Salins. As you rightly said, your journey has been very great, from a dental surgeon to a maxillofacial surgeon to an intricate base of the skull surgeon. And from there, you have gone into the aspect of synthetic intelligence, which by itself is great, and we congratulate you on this aspect. The younger generation take his words. It is not the future dental surgeons or any surgeons for that matter. It is not the theoretical aspect. It is not the practicality of how good your surgical skill is. Sir Ashley Cooper, one of the most famous surgeons of yesteryears, way back in 1854, coined this word. A surgeon should have a lion's heart, a lady's finger, and an eagle's eye. Dr. Salins was sitting beside me, and I was just looking at his fingers. He did not have the lady's finger, he had a very boxing fingers. And I looked into his eyes, he was not wearing a spectacle. Even at this age, he has an eagle's eye. I do not know how big is his heart, whether it is a lion's or much more formidable. Dr. Salins, you have done your work. So we are indeed very proud of you, and we will continue the great tradition you people have placed. Have a good day. May God bless you all.
Dignitaries on the dais and off the dais. So it is indeed my privilege to express that our gratitude to the chief guest of the day, Professor Dr. Salins, Paul Salins. Thank you, sir. Thank you very much. On behalf of the college and NITTE team to the university, we are really grateful to have spent your time with us and motivated our students with that excellent oration lecture. So, on behalf of the Dental College, I wish to thank our Pro-Chancellor, Professor Dr. Shantaram Shetty, who has always been helping us, guiding us with all his knowledge and make sure that we follow certain principles, and he's one of the leaders of the university for reaching this state. Thank you very much, sir. So our sincere thanks to our Vice Chancellor, Professor Dr. Muditaya, sir. Thank you, sir. Thank you for shaping this program. He is the one who has, went through all the missionaries, and he's the one who has guided us to do this. And thank you very much, sir, for all your guidance. And not only in this program, all our programs and activities, sir has always been supporting us. So Dr. N. SRIDHAR Shetty, sir, the founder dean of this college. So thank you for your services. Thank you for your sacrifices, sir. Thank you for your visionary leadership. Thank you for molding all our students all these years and helping us even now in all the administrative and academic activities. Thank you so much for spending your time with us, sir, today on this happy occasion. So I wish to thank our members of the alumni group who have done a wonderful job in instituting this Dr. N. SRIDHAR Shetty Endowment Lecture. I sincerely thank Dr. Mitra N. Hegde, Principal of the college, for, as our Vice Chancellor said, for supporting this program and helping us to organize this program. Thank you, Dr. Mitra. We have among with us Professor Dr. Rajendra Prasad, a very senior maxillofacial surgeon of this country and the ex-principal of our college. Thank you, sir, being here with us. Dr. S.M. Sharma, another senior maxillofacial surgeon. Dr. Murthy, Dr. Gopakumar, and many other. Dr. Amarnath Shanai is here. Thank you very much for your presence. Thank you to each one of the faculty, heads of the departments, students, and yes, our ex-librarian, Shashikala Madam, who has been here with us since 1985. So she recently retired. She's the one who designed our library and managed it so well. Professor Satish Rao, sir, the former HOD of Psychiatry Department of Shema. Just excuse me if I left out anybody, so many of alumni. So once again, I thank our university authorities, Professor Shri N. Vishal Hegde, Chancellor, who could not attend this program. Excellent. Thank you, Vinuta, for your presence. So Harsha, the registrar, Professor Harsha, registrar of university, he's also been involved in this program. He also could not make it at this time. So our sincere thanks to Praveen Udupa, who has helped us with the technicalities of this program, members of the press and media for giving the excellent coverage for this program. And I wish and I thank all the students, the present students and the past students of this college for having attended this program. Wishing you all a very happy and nice day. Thank you.